Retinopathy of prematurity is an eye disease affecting some babies born 30 weeks or sooner, or babies weighing 3 pounds or less that can result in blindness. The retina is the back layer of the eye that covers the inside of the eye like wallpaper. The retina is very important for good vision. Blood vessels are necessary to keep the retina healthy. Beginning about 16 weeks into a pregnancy, the blood vessels of the retina start growing from the back of the eye. The blood vessels continue growing across the retina until they reach the end of the retina and finish growing around 40 weeks into the pregnancy. For babies born before 40 weeks, their blood vessels have not had time to finish growing across the retina. In most babies born prematurely, the blood vessels finish growing normally. But in babies born at or before 30 weeks, or babies smaller than 3 pounds, their blood vessels may not finish growing the way they are supposed to. The environment outside the womb is very different from the environment inside the womb, and this can cause a premature baby's blood vessels to grow differently. This is called retinopathy of prematurity, or ROP. In babies with ROP, the retina's blood vessels can start growing in the wrong direction, for example, toward the jelly-like middle of the eye. These abnormal vessels can bleed or cause scarring in the retina. In some cases, this scarring can cause the retina to pull away from the back of the eye. This is called retinal detachment. Retinal detachment is a very serious condition that can cause a baby to go blind. ROP is the #1 cause of preventable childhood blindness, but the good news is that ophthalmologists can usually prevent babies with ROP from losing their vision. For babies at risk of ROP, it is important for an ophthalmologist to do frequent eye exams to monitor the growing retinal blood vessels and make sure they're growing in the right direction. The first exam is usually 4 to 6 weeks after birth. Exams are performed every 1 to 3 weeks until your baby's eye vessels are fully grown. The exam only takes a few minutes for both eyes. Your baby will need eye drops at least half an hour before the eye exam to dilate their pupils. This will allow the ophthalmologist to see the retina in the back of the eye. When it's time for the eye exam, numbing drops are placed on the baby's eyes so they will not feel any pain during the exam. The baby is swaddled and held tightly so they will stay still and be comfortable during the exam. An eyelid speculum is used to hold the eyelids open. Your baby's ophthalmologist uses a special headlight and magnifying glass to see the retina and the growing blood vessels inside. The ophthalmologist needs to look at the entire retina, which requires the eye to move left and right. Because babies are too young to look to the left or right when asked, the ophthalmologist uses a small round tool called a scleral depressor to gently move the baby's eye as necessary to get a good view of the entire retina. Another way of examining for ROP is through telemedicine, where photos are taken by a special camera for ophthalmologists to monitor for ROP remotely. The eyelid speculum is removed and the exam is repeated in the other eye. Although their eyes are numbed for the exam, babies often cry during the exam because of the bright light and because their eyes have to be held open. ROP is measured in zones and stages. The zones, numbered 1 through 3, describe how far the vessels have grown in your baby's eye. The stages, numbered 0 through 5, describe how abnormal the vessels are. The ophthalmologist will discuss with you what your baby's zone and stage are. In most babies with ROP, the blood vessels finish growing normally and may not need any treatment. However, a small number of babies will need treatment if their blood vessels begin to grow abnormally. Treatments could include laser treatment, medicine injected through a shot into the eye, and sometimes surgery, to help get their retina's blood vessels back on track. Your child's ophthalmologist will need to continue monitoring your child's eyes until the blood vessels finish growing. Sometimes a baby will continue to need eye exams even after they go home from the hospital to prevent them from going blind. Once your baby's blood vessels have finished growing, they will continue their regular checkups with their pediatrician and pediatric ophthalmologist. For more information, visit the Pediatric Ophthalmology page on the Children's Hospital Colorado website.